I'm going to start off by checking your this is called the most long test, and I'm going to have you check your vision. I'm going to have you check your vision just by reading two lines.
The new course will start behind the high school.
Your near vision is intact. I'm going to do the Schelling chart. I'm going to stand 20 feet away, and I'm going to have you read the lowest line that you can read.
DEFPOTEC.
And that is 20/20 for your distance. I'm going to have you cover one eye and read the lowest line that you can read.
DEFPOTEC.
And cover the next eye.
DEFPOTEC.
So that your distance is 20/20, and that's good. And from there, I'm going to check your eyebrows, and I see that your eyebrows, they extend from the inner to the outer campus, and they're symmetrical and they're full, so that's good. Next, I'm going to have you take off your eyeglasses. I'm going to check your eyelashes, and I can see that your upper and lower curl outward, and that's good. From there, I'm going to check your scleria as far as nice and white in your eyes. I'm going to check your skin. Your skin is intact. I'm going to check your lacrimal apparatus, which is right up here, and when I palpate, I don't feel any swelling or edema. Is it tender?
It's not tender, no.
And then I'm going to check your nasolacrimal duct. When I palpate, I don't feel any fluid. Is it tender?
No.
Okay, I'm going to have you look straight ahead. I'm like in your eye. I'm going to check, and I see that your eye, your pupil constricts. So that's called direct response. And I'm going to put the light on again, and I see that in the other eye it constricts, and that's called consensual. I'm going to check for accommodation, and so I'm going to have you look across the room and follow my finger. And your pupils dilate, which is good. So from there, I'm going to do an H exam of your eyes, and that's to check the muscle balance. And I'm going to have you follow my finger. Don't move your head. Lateral, up, down, up, across, up, down, and I see that you have parallel tracking of your eyes. So that's good. So I'm going to have you cover each eye. I'm going to check your peripheral vision, and I'm going to cover my eye with you, and I'm going to take my two fingers, and I'm going to have you let me know when you see my fingers.
I see them.
And laterally.
I see them.
And
I see them.
okay, and then cover the next eye. And do you see my?
Yes, I see them. I see them.
And again.
Yes.
Okay, good. So the peripheral vision is intact. Ears, and actually I'm going to check first the skin, any tenderness on your ears.
No.
How about your mastoid process when I palpate?
No.
Okay, I'm going to pull up your ear, and I'm going to look inside the canal, and I see that the canal is pink. There's a tiny bit of cerumen. The tympanic membrane is pearly gray. Cone of light is present, and there's no tenderness. So that's good. I'm going to do a hearing test. I'm going to stand 2 feet away. I'm going to have you cover the ear that's closest to me, and I'm going to whisper 3 words and tell me if you can hear them. And tell me what they are.
Cat, dog, squirrel.
I'm going to go to the other side. I'm going to have you cover that ear.
Cat, dog, squirrel.
Good, your hearing's intact. I'm going to check the Weber test, which is I'm going to use a tuning fork. Put it on the top of your head if you can tell me when you don't hear it anymore.
I don't hear it.
And then I'm going to do a Rhine test, which is I'm going to place it on your mastoid process. Tell me when you don't hear this.
No, I don't hear it.
And then I'm going to put it right here on your shoulder and tell me when you don't feel it anymore.
No, I don't feel it.
So the conduction is 20 to 10, so the air conduction should be greater than your bone conduction, so that's intact. Next, I'm going to check your nose, and your nose is midline. When I press down, is your bridge of your nose tender at all?
No.
And the skin coloring is the same as your other coloring on your face. I'm going to look inside and your ears, and I see that there's bilious here, there's no discharge, no lesions, and your septum is intact. And then I'm going to check your sinuses, your frontal, any tenderness?
No.
And maxillary?
No.
Okay. And then I'm gonna check your mouth, and I see that your lips are nice and pink, and intact, and there's no lesions. And they're symmetrical. I'm gonna have you smile, and I see that your teeth are nice and white, and your gum lines are pink, there's no retraction. And I'm gonna check your hard palate. Your hard palate is pinkish white and moist, and that's good. I'm gonna have you check your uvula, which is midline, and I'm gonna have you stick out your tongue. Your tongue is midline. I'm gonna check your soft palate back there, and that is pink and moist. I don't see any lesions. I'm gonna have you lift up your tongue. I don't see any lesions, and that is pink and moist also. I'm gonna have you say ah, and I see that you have +1 visible tonsils.